samples from various sources, whether it be a GP referral, a practice nurse, or even self-referral. We then meet with people either in the clinical setting where we have a base in a GP surgery, or we're able to meet them in the community at a local community centre or at a children's centre, so that people have a choice to choose an environment that's comfortable for them. We meet with them and we work around action planning, so we look at their diet, their exercise, and what changes they need to make. But we don't tell them what changes to make, we just encourage them to think for themselves, to look at the options, look at what they're doing and what they could do better. We then put this in a plan, meet with them regularly, so we're able to offer them more time than, say, a GP would, as we're able to meet with them for a whole hour once a week to 8 weeks, so that people can have that one-to-one time. We then signpost them to other local activities, so a lot of the stuff that we signpost them to doesn't have to cost money. A lot of it's free local activity that's provided by other services, mainly the VCF sector and the health champions. So, for example, one of my clients needed to get more exercise, so we referred them into a local walking group, which was run by the health champion scheme. So it's run by volunteers that are the same as them, so they're able just to engage on a peer-to-peer level, so that they're getting the support of the friendship, they're getting the exercise, and just getting out and about more, being more active. And then the health champions then can work with them further if they wish to. So if the client wants that extra support, they can talk to the health champion about getting more one-to-one sessions.
Okay. Prior to being a health trainer, I've been a community health champion, and my role is span around supporting people sometimes on a one-to-one or in group session. For example, I had a client who wanted to do more physical activity, and one of the things she wanted to do was learn to ride a bike. We had a cycle for health session, 8 sessions of course, and she came to them. She was really cowed at the first time, very nervous, and because there were more male than female. And I said to her, I'll stay with you, you know. And she stayed with the qualified instructor for a short period, like getting her balance and everything. And once she could get her balance, then we went a bit further out of her comfort zone. And I was a back marker and encouraged her. So at the end of the day, I would say to her, have you improved, or what have you done today that you feel really good about? And she'll do her booklet about the things that she's learned. And it was somebody in the community, so we could meet up and talk about it as well. So one of the things that she continued doing is kind of practicing on her own, and even started going to a running club. For her, she wanted to be out, she wanted to enjoy the atmosphere, meeting new people. She was unemployed. It's something she wanted to do, to be in contact with other people, lose weight, do something that she enjoyed doing, and something that she wanted to learn that can help her